Well, good Monday morning, everyone. If we haven't met, I'm Brittany, a nurse practitioner, and we have Sam in the chats, who's also a nurse practitioner. And today we're going to be talking about next steps. So you're getting ready to sit for your boards, or maybe you just passed your boards. It's December. If you are graduating this month, congratulations from us here at Archer Review. And we're basically just going to be talking about an overview of the professional role of the nurse practitioner today and just about kind of those next steps to kind of get you started in practice. Now, Sam is here for questions. She can, send those along as we go. And let's see here. I'm going to pause just a minute. I'm getting a message from Sam. Sam, are you able to see everything set up okay?
Can see your screen. I just can't see you. If you just want
Oh,
to turn your camera
okay.
on. You're good.
Okay. I probably need to open my camera lens. Wouldn't that be helpful? How
There
about
we
now?
go. Hello, good morning.
Okay, good morning. Yes, I cannot see myself, so I never know what you're seeing or doing. So, thank you for that. All right, so like I said, we're going to be going ahead and getting started because there's a lot to cover here. And again, any questions that y'all have, we are here to help you with that today. So let's go ahead and talk about those next steps after you pass your nurse practitioner boards and what you're going to want to do before you kind of start seeing patients is where we're going to start. So, of course, um, talking about role transition here. So, congratulations. We're going to go ahead and talk to you as if you've passed because I know if you all are using the Archer Review products, you are going to pass successfully coming up if you haven't done so already. So, obviously, all of you have worked so hard so far, whether or not you have passed or not your boards. I know just to get in here and listen to this lecture today, you have already put in a whole heck of a lot of work. And so, most of you guys have already got your RN license and have been working as an RN in some form or fashion at some point in time. And so, this is just a reminder that you need to start really keeping a binder if you're not already doing so, or something with all of your information in it. So, maybe you have some certifications in CPR or PALS or ACLS, whatever that be. Maybe you already have your RN or LPN or whatever license you're working on, your nurse practitioner license, whatever. You might already also have like a specialized certificate within a role, like critical care nurse or something like that. So I want to just take a moment to remind you to start putting your things together and making sure that you are keeping up with all this paperwork because whatever you've been doing already has been a lot, I'm sure. It's fixing to get a whole lot more tedious and intense and a paper trail to keep up with. So just go ahead and start off on the right foot there. Of course, to become a nurse practitioner and to sit for the nurse practitioner boards, you have to be an RN in good standing. Most likely have to have your CPR certification for wherever you're going to work. And of course, most of us probably did that a couple of years ago when we were starting in nurse practitioner school or re-enrolling in some of those clinicals. And so it's important to check and make sure that you're not for renewal. That's another thing that you might want to check before you start putting out word that you're employable again as a nurse practitioner. Also, just a few fast facts for you here about nurse practitioners. It's a very up and coming role. It was actually ranked number 1 on the job market for Outlook here just in this last year. But 88% of nurse practitioners are certified in an area of primary care. And 70% of nurse practitioners actually deliver primary care. So that's a pretty overwhelming statistic there. 96% of nurse practitioners prescribe medications, and those in full time practice write an average of 21 scripts a day. Nurse practitioners hold prescriptive privileges, including controlled substances, in all 50 states and DC. We're going to talk about how to get a DEA set up a little bit later in the webinar. But in all 50 states, we're able to write prescriptions. Looks a little bit different for everybody. We'll get into that. In 2021, the median base salary for nurse practitioners was about 113,000. The majority of full-time NPs see three or more patients an hour, and the average age of a nurse practitioner is 46 years old. So, if you're a younger NP coming up, that's actually good news because, again, the field is looking to grow and expand, and a lot of the nurse practitioners are going to be reaching that age of retirement within the next 20 years. And so, we're going to need people to fill those roles. So, that's actually really good for job security. Talking about resumes, you are probably going to get ready to get your resume together, start applying to some nurse practitioner jobs if you haven't already. So, just a few little tips that I like to throw in on my students when we're talking about resumes and looking over resumes. And remember, here at Archer Review, you can always book a slot to look over your resume or be mentored as well. I'll give that link a little bit later. But I want you to think about this. If the job description has keywords in it, the words like prescribe or the words like care for or manage, you want to tailor your resume to match that. I have managed, 6 patients on a med surg unit, and that experience is going to go and be in your favor. Also, using a search engine, so like something like Indeed or LinkedIn. Also, having a well written objective. I'm a detailed oriented nurse with X number of years of experience, and I am now looking to join a, dynamic primary care practice, whatever, just something that you want to kind of tailor to them to let them know kind of what you're looking for, because not only are they interviewing you, you're also interviewing them. You want to make sure that this is a good fit for you when you're looking at these jobs. Also, remember, put your most recent job or experience first, and school experience is okay. So, if you had, 700 clinical hours, that's nothing to bat an eye over. You want to talk about where you've been, what you've been doing, how you've been helping to manage care for the patients that you've seen in those populations. And then also, you're going to want to explain any gaps, whether it's you took off for maternity leave or, family leave or for school, whatever it be, explain gaps in your resume. You're going to want to provide some references, and then also always, always, always run your resume through a spelling and grammar check, because we want to make sure that when we're sending this through, and we want to make sure that we are making sure that we're at the top of the pile because we are writing coherently, competently, and have good spelling, because that's going to be important for our documentation later on. So, just a few little resume tips for y'all. If you want to talk more about resumes, we are happy to do that here at the Archer team. All right, now let's talk about licensing. So, we're going to go through some terminology and some step-by-step processes of transition from student to nurse practitioner. Okay, so remember, licensing is that first step of the process. It's when an individual goes through an act of obtaining permission from a higher authority. You guys probably have already been through a licensing process by taking your NCLEX and working with your state board of nursing, right? So, you've already obtained one license. Well, you're fixing to get another one, okay? So, an example of that I just gave you, but as a nurse practitioner, you're going to be granted another license from your state board of nursing after you take your boards exam. And your scope of practice, again, this is important. In fact, I think this is even a practice question we give out around here sometimes, isn't it, Sam? That your state board's Nurse Practice Act is going to basically talk about your scope of practice for your state. So if you're not familiar with that, that would be a document that I would want to become familiar with of what I'm allowed to do and not allowed to do within my state. It's going to vary for all of us because Sam and I are in two different states. What she does at work versus what I do at work could be two kind of different things of our scope of practice. And in addition to this, in addition to the required educational training and delegation of the nurse practitioner title, this legislation will function as the rule book for U.S. nurses. So again, just knowing where to find that. And again, if you see questions pop up, that's usually the answer about your State Board of Nursing Practice Act. Okay, now, National Provider Identifier Number. This is probably something that you have not done. This will be the second step in your role transition process. So unless you've been an RN billing independently, or maybe you worked in another field like physical therapy or a dietitian, something like that, where you've been billing insurance, you may not actually know what this is or be very familiar with it, even if you have heard it talked around. So basically, your NPI number, this came about in 2004 because of the Balanced Budget Act. And basically, CMS, or the Centers for Medicare and Medicaid Service, is the federal agency that runs Medicare, Medicaid, and the Children's Health Insurance, as well as Marketplace Insurance, define the NPI as a Health Insurance Portability and Accountability Act, HIPAA, right? Administrative standard, which is a unique identifier number for covered healthcare professionals, created to help send health information electronically more quickly and effectively. And again, we talked about it started with the Balanced Budget Act in 2004. This standard and unique identifier is going to apply to all healthcare providers, health plans, clearinghouses, and CMS developed the National Plan and Provider Enumeration System, also known as NPPES, and you can go to their website to assign NPIs. And we'll put the link in the chats for you, basically how to go about getting your NPI. And it literally takes like 5 to 10 minutes to get an email back saying you've been assigned once you provide the information for them. It's not hard. And then that will be unique to you. So wherever I go, I can go from the South all the way up to New York. I'm still going to most likely have that same NPI number. So that is assigned to me. All right. Now, we're also going to talk about credentialing, and this is the third step of the process. Credentialing is a process for providers to go through. So, since likely you most likely have not worked as a healthcare provider in that actual role before, you probably have not been credentialed. Again, unless you were doing some sort of billing and coding something or charging fees for services, you're probably not going to be super familiar with this process. Credentialing is difficult, it is timely. So, prepare to spend a lot of time on this. In fact, your employer might help you with this step as well. But an organization will basically go back to the primary source to verify someone's information is accurate and that they're who they say they are. So, my mom had heart surgery a few years ago. I definitely wanted to make sure that the doctor who did her heart surgery was who that person said they were and that actually had been to school for cardiology and cardiothoracic surgery. And I wanted to make sure that this person was safe and was, who they said they were, right? And we all want to do that. And so this helps basically patients to know that they can trust their medical provider has obtained their training, licenses, certification, and meets all the qualifications to perform their job function. And credentialing is often done by the hospital or healthcare organization that employs the healthcare professional. So again, very lengthy. They're going to want to know all of your school information, and there's where that binder comes back into play. So again, something very important to do, a process called credentialing, and you can look that up and you can find a wealth of information on that as well. All right, something I want to call 3B here because not every state requires this, but basically is entering into a collaborative agreement. Okay, so not everybody's going to have to do this, but it's going to go back to your scope of practice. And this collaborative agreement is when a nurse practitioner and a physician work together to provide care for patients. Now many states, I think 20 some and counting, now allow independent practice of nurse practitioners. However, many states are still requiring collaborative practice between the nurse practitioner and a physician. And if your area does require collaboration, you'll need to look this up. It might be reduced or restricted authority. And basically, reduced authority is where some aspects of your scope may be performed independently, whereas restricted is where all of your scope of practice will be guided by the collaborative physician. So again, just look and see your state, and there's a nice little interactive map that you can look at on the nursejournal.org/nurse practitioner authority by state. And that's an interactive map, and it'll give you the states of where independent versus restricted versus reduced might be. And so this is just something that you want to be aware of. All right, now let's talk about 3B as well. Something that you might want to do, something that you may choose to do later on. And this is not going to apply to every single person, but if you are doing a DEA registration. So that is someone who is allowed to write controlled substances. Okay. So this one here is where you may have to go to a class, you may have to go and, do certain things to get this. But I've just basically put in the information link for you because, again, this is going to vary by state of how you obtain this. Like, for example, some states might say the nurse practitioner has to be in practice for a year before they get this or whatever. So again, you can check out this website right here and it will tell you exactly how you would get on to write controlled substances if that is something that you are going to be required to do for your job in the future. All right, now you're ready to start seeing patients. So you're already worn out from this process, aren't you? But a few more things that I want to give you before you get that true green light to light up for you. If you plan to work in the United States, most clinics now have transitioned to keeping electronic health records for each patient due to the HITECH Act. I've also seen boards questions regarding this. And this Health Information Technology for Economic and Clinical Health Act, or HITECH Act, was also set by CMS and encouraged those healthcare providers and facilities to transition to electronic charts, basically. Also, they want them to have a decision-making tool within the patient chart. So, for example, my chart at work, when I go to prescribe a medication, has an interaction checker. It also has Hippocrates that you can bring up. So, something within that chart that kind of helps you to make decisions or look things up. And again, it just goes all back to patient safety and making sure that you're checking to see that everything is lining up good before you give those patients the medications or make decisions, whatever you're going to be doing. So this is just a act that was put in kind of to help with patient safety, and I think it is a good thing. But it is just something that I want to just put right here on point 3 is whenever you're hired on, make sure that you're getting training on this chart. These chart systems are very big. They're not hard, but they are tedious to get through. And you kind of know where to click within there, just like when you were an RN and maybe you were going to start working with Cerner or Epic or whatever your program documentation system is at the hospital or wherever you've been working. Just make sure that you get that same training before you agree to see patients. So that's just one thing that I want. That's your key takeaway on this slide. It doesn't matter what they're using, just make sure that you're trained on it. All right, now you're looking for jobs during this time, aren't you? So, what type of work are you interested in? What type of care do you want to provide? So, why don't we take this minute? I'm going to open up the chat box and I want you to think about some of the things that you would like to be interested in as you're looking for jobs. So, just because a job offers you placement there doesn't mean that you necessarily want to take it. You want to find somewhere where you are comfortable and where you are working with them and that meets your care philosophy. So let's just go through a little bit of healthcare delivery model options here, okay? So first of all, the healthcare delivery model, regardless, is important for the office to function well. So, it doesn't really matter what they're doing as long as it lines up with your philosophy of care, but also making sure that this office functions as a team. That's going to be even more important. Also, when you're doing these interviews, ask what services are available to you. So, for example, do you have x-ray on site or is it down the street? Do you have mammograms in-house or do they have to go down to the main hospital? Do you have labs? Do you have a social worker or a care coordinator? What type of personnel will you have to help? And I would definitely recommend making sure that you have some sort of assistive personnel when you're working at these clinics. And it's just not a one person show because that's going to really tie you up. So just, making sure that it goes with your care philosophy and making sure that you have the help that you need. So fee for service historically is just traditional. What we get at the doctor's office, it's reimbursed by insurance for services provided. A value-based care, CMS and many offices are actually moving to this model now as it focuses on patient outcomes, quality of care, and preventative strategies. Direct primary care focuses on really enhance the patient-provider relationship. So maybe you are a one-person show providing direct primary care, but you have an hour to see the patient. So that's a big difference than you're doing fee-for-service and seeing 3 patients an hour by yourself. So again, just making sure that it's going to work for you. And remember, the direct primary care is going to be a flat monthly fee. It's going to be more affordable. It doesn't doesn't really work with insurance much. Concierge is more exclusive and personalized, sometimes called like boutique or higher end medicine. Annual high annual membership fees, but often works with insurance as well. So again, just kind of look at those if you're looking to branch out and do something a little bit different. Again, these all have their place. Independent contractor, these are self-explanatory pretty much, but locum is just temp assignments, or a contractor might get a little bit more on the hour, but may not have benefits, things like that. And then for those who like to travel around, this might actually work out really great for you. So again, just lots of different things here, making sure that things line up for you and kind of what your goals are as a provider. All right, let's open up our chats. Where are you guys? Okay, so we have peds on here. Okay. So another clinical practice to be aware of is billing. This is not something that we get a whole ton of in school, but basically the International Statistical Classification of Diseases and Related Health Problems, or ICD codes, are medical classification lists, which are defined by the World Health Organization and are used for insurance claims and processing. So right now we're on version 10. So you might have heard ICD-10 codes thrown around. But we're going to be going to transition to 11 in the future and so on. Now, another thing I just want to put right here, and I've seen questions regarding this, is incident to billing. This allows for insurance reimbursement at 100% rate for physicians instead of the 85% reimbursement rate for nurse practitioners. So this is important. So let's say that the physician comes in and I'm working today and I'm seeing, Mr. So and so for blood pressure follow up, that he was started on lisinopril, 2, 3 weeks ago by the physician, and I'm doing the follow up today. If the physician is in the building, then technically I could bill that as incident too. But if he decides that his finger hurts today and I need to put a little band-aid on that for him, then it's no longer incident two. It's basically if a new problem arises during the encounter, then the incident two billing is not allowed. But if we're just talking about blood pressure, then technically you can get 100% reimbursement rate if the physician is in the building when care is given. Okay, so that's one that I'll just be honest, like it sounds really great on paper, but it just doesn't happen that often because there's always, something, right? Everybody's got the sniffles this time of year, or they want to get their flu shot, or whatever it be. So, a lot of times that just doesn't always happen. But again, if it's just a little thing that you're addressing, you can consider billing that way. All right. Common codes in primary care. This is nothing to memorize, but this is just something I want you to be aware of when you're looking things up. Ask yourself, is this a new or established patient? Remember, new patient codes end in like 01 to 05, and then established codes is going to end in 11 or 15. Also, there's well child codes. There's Medicare codes that starts with G. You'll hear them called G codes. So again, nothing to memorize, just kind of knowing what your coding is for billing. And I will tell you this, a lot of times where you work, there's going to be some billing and coder experts hanging around for you to tap into and utilize their knowledge. So before I go hog wild and start billing things that aren't super common or whatever it be, I try to talk with them and get their advice on what would be best. Or sometimes they'll just ping me and be like, hey, that code wasn't great. Why don't we do this one instead or whatever? And if I'm agreeable, I can put it in. So again, you can use this. You can have them to help you with billing and coding when you're kind of getting started. And I would recommend sitting with them for a couple of days and just seeing what some of the common codes are for billing and kind of some of the rules when you go. So again, nothing to memorize, just something to be aware of when you're getting started. All right. Remember, some visits are 366 days versus a calendar year. So, if they're scheduling a wellness visit or something like that, some of them might come in January and then they can be seen, or maybe like they came in July, they can be seen in January, whatever, for their wellness visit. But a lot of times it's like if they were seen July 30th, they can't come back in till August the 1st. Whatever it be, it has to be 366 days. So that's just, again, a little caveat here for insurance, something to be aware of when you're making your schedules for your patients. All right. Now let's talk about some different types of insurance that you might encounter. Many times an office is going to have someone who will help you with the billing and coding, like I talked about. So use this person as a resource or this team as a resource. And an HMO or health maintenance organization provides health care for a set monthly or annual fee. So often patients are going to have fewer out-of-pocket expenses, but they're going to be served by a little bit smaller pool network of providers, and out-of-network providers probably won't be covered. A PPO or preferred provider organization is larger, and often patients will pay more out of pocket fees to assess a larger number of healthcare providers. Referrals are not needed, so therefore they have a little bit more flexibility when seeking care. And regardless of which option they choose, they often will have vision, dental, medical, prescription, and hearing aid benefits for their plan. So again, nothing to memorize here, just kind of knowing what your patient needs when they come in. You know, some people like in January of every year needs three referrals because they see their heart doctor, their pulmonologist, and their eye doctor. And just to go there, they have to have a referral every year. And so we put that on the books for them, at the first sign that we can. Others will be like, nope, I just went over there and saw, the eye doctor. It was no problem. So just something to be aware of with your patient needs when they ask. Okay, couple other insurance options. Medicaid provides low-cost health care, specifically focusing on people with disabilities, lower incomes, and vulnerable populations such as women, children, and elderly. And then this is state and federally funded program in the U.S. And then Medicare, adults over the age of 65, again, federally funded, and those with certain disabilities may be eligible for coverage sooner. Like I know that people who are on dialysis often will qualify for Medicare. So it just is going to depend on what is going on with them and if they're eligible or not. If you see Medicare, they'll be on different parts. Part A and B, everybody has. That's just your standard Medicare. It's going to cover basically your doctor's visits for B. A is hospital bills or inpatient care. Part C will be something that they can buy separately out of an Advantage plan from a private insurance agency. And D, I remember for drug, because that's going to help cover their drug cost. So just a few different things of how Medicare works. Again, you can go to the Medicare website and read way more about this than I'm telling you on this one slide. All right. Sometimes patients need some additional levels of care. This is actually a whole branch of specialty that you might be interested in looking into. Hospice and respite care. Hospice is defined as the end of care of life for people who are determined by a medical professional to have 6 or fewer months to live. Life-saving treatments are often stopped, and instead they focus on quality of life. Whereas palliative care allows for a person to still come in and get medical care that may cure them, like think about chemotherapy, but still focuses on quality of life. Think about chronic illnesses. Think about this can last for months or years. And then respite care can often be performed inpatient or outpatient. And it's a short-term care for a child or elderly adult to provide a break for unpaid caregivers such as family members. So just a few things that you can offer here if that is something that you're interested in. Again, just trying to open your eyes to the things that are out there that we can do as nurse practitioners. Speaking of prescriptions, let's talk about prescriptions. So, you as a nurse practitioner will most likely be writing prescriptions, especially if you're working here in the United States. I just told you all 50 states and DC allows nurse practitioners to write scripts. The first thing I want to talk about here is the superscription. That is basically what comes before the body of the script, and the superscription includes the patient's name, birth date, address, current date, and that's what's going to be pretty much. So think about it like your letter heading. The inscription contains the name of each medicine and the dosage amount. So the subscription is the instruction to the pharmacist, while the signa is going to be the instruction to the patient on how to take the medication. Okay. And that is basically, I've got it labeled here for you. You can look at that. You'll need to put how many refills you're authorizing and sign your name, address of your practice site, DEA number if applicable, your prescriber registration number, and a word of caution here is to never keep signed blank prescriptions in your desk. And also never or always check your patient allergies. So I've got that in red. That's the key takeaway from this slide is don't keep those signed scripts in your desk. All right, so we're going to pause here and take just a little break. We're getting ready to go through a couple of practice style questions. So in case you're getting ready to set for the boards, you know exactly what you might could see on professional roles. But in the meantime, I'm going to just take a breath. If you need to fill up your coffee cup or whatever. And Sam also has already said there's going to be a giveaway today. So stay tuned for sure. Last week we gave away a Sure Pass package, and that was a really great prize. And we're going to do another giveaway today. I don't know what it is, but I promise you with Sam, it'll be good. So, I just want to turn your attention to this screen for just a minute. So we literally just passed, like launched SurePass Pro. And basically, we just want you to pay attention here that regardless of if you sign up for anything today or not, we want to connect with you. Okay. Basically, we want to talk about there is in the bottom left corner here our social pages. Now, do giveaways on there a lot of times. We also will do practice questions of the day. We advertise for these webinars. We put all kinds of free stuff on there for you, like all the time. So click that QR code, and that is something that I would advise everybody to follow. We also have a nurse practitioner Facebook group as well, that's a little bit more private. And so we have two things that we can do to kind of connect with you. And then, of course, we're on Instagram, TikTok, Facebook, all these different things. So, again, just connect with us. We are a really close knit community, and we really are there to try to support each other. So, that's one. Another free thing that I have on this slide is a free trial. If you have not taken your boards yet, I would recommend signing up for the free trial of the question bank. It's free for 7 days for everybody, and it has over 1,600 questions, and there's also a readiness predictor, and this is something that you can kind of use to help gauge where you're at before you sit for your test. So again, lots of free good stuff given here by Archer every day. Also, if you have specific questions, we have nurse practitioner at archerreview.com here for you. You can reach out, and Rachel and maybe Sam helps with this too, but they look over all the emails and we'll get back with you. Now, talking about a couple of our packages that we have that we've just recently launched. Of course, you have the question bank. And then on demand is 16 hours of bite-sized videos that you can take on the go. So say I just want to talk about, STIs today. Well, I can look that up and watch a little short video on that, and gives me an on-demand clip right there to my phone or computer. Also, we have our live reviews. I don't have that up here, but if you go to our website or email us, we'll give you information. We have another one coming up in January. So if you are graduating this month and you're not taking your boards until after the 5th of January, you can get in on the 3-day live review still. And that is 3 days of just intense topics with our nurse practitioners that we go through and talk about every system broken down, including professional and culturally competent care, anything that you might see on the boards, any topics. And then last but not least, we have SurePass Pro, and that basically puts everything together. And the thing that I love about SurePass Pro is that there is a pass guarantee. You get mentoring sessions with our team, in addition to all these things that we've just talked about. So I've got you a link here. Just check it out. Even if you don't commit today, it's no pressure. I just want you just to know what's there and available to you. I want you to look at SurePass Pro, see if that's something you're interested in. Again, we're going to be having giveaways throughout the month, and including today. So stick around. And if you didn't win it today, it might be something that you want to sign up for, tomorrow. So it's just something that you can take a look at. So that is my spiel, and I'm sticking with it. All right, let's take a look at these practice questions. Practice question 1. You're looking to see if your state requires a collaborative practice between nurse practitioners and physicians, and you know to consult which legislative document. You guys better get this right. I harped on this for 5 minutes at the beginning. So I will pause for just a minute. Y'all put it in the chats. What you think it is? State Nurse Practice Act, Transitional Care Model Act, Patient Safety and Quality Improvement Act, or Health Insurance Portability and Accountability Act. And don't forget that is basically HIPAA. All right, I see some answers coming through. Give you just a minute. All right. All right, that's right. Vincent's on it today. The Nurse Practice Act sets the scope of practice for all nurses, regardless of level. So, even your LPNs and your lower level of nursing, it has all that in there. Of course, I've talked to y'all about the Transitional Care Act model as part of the Affordable Care Act. Patient Safety and Quality Improvement Act encourages individuals to report medical errors, and of course, HIPAA, we all know, talks about how we can store and disclose patient information. All right. Let's talk about practice question 2. While working in an urgent care, you're providing care for a 9-year-old patient with a prescription for amoxicillin for bilateral ear infections, and you want to write a script for the patient to take 1 tablet twice a day. Which part of the prescription should this information go? The superscription, inscription, the subscription, or the Cigna? Where should this go? So this is information for telling the patient what to do, right? So where's it going to go? I'm going to open up our chats. Give y'all just a minute. Okay. Some answers coming in. Great job, guys. Absolutely. This is the Cigna, the part of the prescription for the pharmacist to write down the instructions that the provider wants to tell the patients. Remember, this is a PEDS patient, so include the weight on the patient's prescription would be a prudent thing to do. So, all right, very good. All right, let's keep moving along. Y'all are doing great today. Now, let's talk about malpractice insurance claims. If insured when a claim is made, well, first of all, we have 2 different types of insurance. So, one thing I'll say is, regardless of which kind you get, regardless of who buys it, whether it's you or your employer, just make sure that we have insurance, claims based versus occurrence based. So, let's talk about this. If it's claims based, if insured when the claim is made, it will cover you. But once it's canceled, an incident is no longer needed. So that's why you might need tail coverage. Most common type of insurance from employers, right? If you're no longer working there, they're probably not going to be paying for your insurance. So you may want to look at getting a tail coverage policy. Occurrence is going to be provides coverage regardless of when a claim is made or a policy is canceled. It's more expensive and you don't need tail coverage. But basically, regardless of where you're at in this, the claim is made, it's going to be covered under occurrence. Okay. So let's say you start here on, 2023 and you're going to end in 2026 and there's some sort of claim made in the middle. You can see, regardless of which, or whichever insurance you have, it will or will not cover. So again, just knowing the difference between the two. There's also something called nose coverage. And that's like if you want to pick up something like before you start a new job, and then again, the tail coverage. So there's like different things that you can do for your insurance. Also, we talked about nose and tail. So, prior acts coverage or retroactive date of coverage to protect you. So, changing insurance coverage, insurance carriers for nose coverage, like I just said. And then tail coverage is going to be extended coverage to protect after your insurance policy is expired or canceled. So, like for example, if you're changing jobs. So, again, regardless of who pays for it, never go bare. All right, let's talk about just protecting ourselves as nurse practitioners in the community. I want to talk about some legal protection for yourself. Malpractice claims for nurse practitioners are unfortunately on the rise, and here are a few ways to protect yourself. First of all, practice it within your scope of your state Nurse Practice Act and maintain your licenses, your certifications, and stay current on your clinical knowledge, just like you're doing right now. Even if you've passed your boards, you want to continue to get information and expand your knowledge. Document promptly, including objective findings as well as signs and symptoms to report, and maintain files that support your character, such as a performance review. Let's talk about this. One case that we saw here when we looked at some ideas to share with you guys is a patient had a skin lesion. The nurse practitioner did a shave biopsy and treated the area, then had the dermatologist interpret it, failed to send the report to the pathology. 3 months later, the patient presented to the ER with numbness and tingling and was diagnosed with metastatic melanoma. It was later determined that the NP had alerted the derm to look at the lesion for the biopsy. It might have prompted them to send it for a pathological lab review. And this case highlights the importance of collaboration and elevating the level of care in a timely manner. And then this one was a 40-year-old complained of gout. The nurse practitioner had noted one leg was more swollen than the other, treated him for gout with prednisone and steroids. And a few weeks later, the patient came in, and basically the NP had said that they were doubtful of a DVT, but did not order an ultrasound, rather gave another steroid injection. The patient returned the following day with increased swelling, positive for DVT. The patient was sent to the ER where he died of a PE later. Jury ruled that the ultrasound should have been done in a more timely manner. So again, talking about delayed diagnosis or failure to diagnose. All right, let's talk about some things that we can also use as we're going along for help. Remember I talked about how your EHR will have a lot of tools built in. One of the ones that mine has is like an ACSVD risk calculator. You can catch my talk on the big three from the other week if you want to hear more about that. But MD Calc is where I pull that one from. Family Practice Notebook, this is free. Also, Up to Date, Hippocrates, these are more paid subscriptions, but again, nonetheless, more useful or helpful. And so there's just some options for you as you're going through of some resources that you might want to use. Okay, also let's talk about staying organized. Just for some final thoughts here. Start a binder now, put all your important documents in it. Consider making a section for all your licenses and certifications. Create a spot for new employee paperwork, policies, procedures, and a copy of your resume and collaborative agreements or other legal documents. So we talked about that binder. Get it today and get it started. Also, want to just stop and talk here about a residency and a fellowship. If you are interested in that, you can look down here. Basically, this is a little bit more additional training. You're already working as a nurse practitioner and getting started like as a new grad, but you might want to look into doing a residency or a fellowship to give you some more experience. Maybe you feel like your clinical skills could use a little bit more time or help, or you want to rotate through some things, you can go through a residency or fellowship. And in fact, Morgan Buss, who's on the Archer team, could talk to you about that because I think she did one previously and had a very good experience. So book a time to talk to Morgan if you want to talk more about this. Okay, so I actually polled the NP team when I was getting this lecture together. And basically, this is their advice for you. So, first of all, Rachel, you guys know Rachel Ward, get comfortable with the uncomfortable. There are going to be things that you just simply don't know. You're going to make mistakes, and it's okay as long as you're using your resources and asking for help. So, that's Rachel. She's a seasoned nurse practitioner. Choose a practice that is willing to train a new grad. The practice needs to be understanding the commitment they're signing up for when they're hiring a new nurse practitioner and provide the appropriate support. Again, great point. That's from Heba. You guys also probably know Heba. Jada, also, she's around a lot too. Y'all see her sometimes. Utilize the appropriate resources available to you. So, again, talking about some of those resources from that previous screen, those were actually from Jada on her tips. And then also, Laverta says, you know more than you think. Trust your instincts and never be afraid to ask questions. Find a colleague that you can reach out to when something doesn't feel right, or you just need someone to remind you you're doing a great job. And that is so true because it's easy to kind of get down in the weeds and kind of get hard on yourself and, forget that, hey, you are doing a lot of good work here. So again, just a few tips from some seasoned nurse practitioners, just to kind of help you as you're getting rolling. There is going to be an adjustment, just like when you went from, novice to, we'll say, expert in, as an RN, it's going to be the same thing as a nurse practitioner. All right, I'm going to go ahead and open back up the chats and talk about some things here. Sam is still here, so if you have questions, and also Sam gave some great things. Employers often will give you some contracts, paying for memberships, negotiate as it's expensive. And then also Sam has also just now put in a chance for the survey for a chance to win here. So we're still here if you have questions as we're doing. Also, I will leave you with this slide before I completely turn it it over to Sam here in a second. For if you want mentoring, if you are, going to be taking your boards coming up and you want to go back through some of these systems, or you want to talk about some more of this stuff, then book a mentor session or a tutoring session. We're happy to help you. I think we're all on there and have some differing availabilities. So I'll leave that slide up for just a minute. And then, of course, we will leave this SurePass Pro, join our community, up for you as well. So I'm going to go ahead and turn it over to Sam today, and she is going to finish up with you guys.
Hello, welcome everyone. That was such a great presentation, Brittany. I love hearing you speak, and you have definitely a great knowledge span here. And especially, I remember as a new grad, I was so overwhelmed, like, what's my next step? Okay, I take my boards, but now what? So this is super, super helpful. As Vincent said, excellent presentation. So go ahead and fill out that link in the form, or the link in the chat for me. This is going to help give us some more ideas for webinars that are upcoming next year. But also your spot to win something. And I think we're probably going to give away a SurePass Pro package today. So if you are taking your board soon, definitely check that out. Let's get you guys winning. And then definitely put any questions in the chat here for me too. Brittany's still on, so she can speak to that. Thank you, Nisha. So happy to have you here today. Make sure you definitely fill that survey out. I will be inputting everything as they come trickling in. See if we have anybody yet. Any questions? Who's testing soon? Have you already tested and now you're looking for guidance on what's next? Let me know. We like to interact with you all. Yeah, and Brittany just posted our email there. So if you have any questions about what's next, definitely take a look at that. Email us. We're here for you. We're really about supporting you through your journey and supporting you as a new NP. Oh, congrats. You want to pass your RN soon. That's amazing. And then Vince is studying day by day. For sure. That's what we recommend. Definitely. Take it one step at a time. Don't overwhelm yourself. No more than a few hours a day. Do some practice questions. All of that. So be sure you're doing the survey for me. So far, I have one participant. So let's get more people in here. Yes, Nisha, the link is in the chat. I'll go ahead and bring it back up here. I know I threw a lot at you at the end. There's the link. Go ahead and click on that and fill out the survey. And like Brittany mentioned, we have a wide variety of resources for you. So wherever you are at in your journey, definitely join our free Facebook group. We post a lot of content, some study questions. That's really a place for you to ask any content related questions. We are there with an NP expert from our team there to answer those for you. And then, the question bank is there. We do the webinars. We have our on-demand library, our 3-day live, which is coming up in January. It'll be here before we know it. So if you are testing soon, be sure to do that too.
And I'll just come back on and say too, you can purchase the 3-day live by itself too. Again, we didn't have that listed today, but that's another option for you as well.
Here's a great question that got asked. Would you recommend limiting to 2 sources? I would, just because it is overwhelming. Some throw questions at you, really, really difficult questions. I would definitely just stick to 2. That way you don't overwhelm yourself in any confusion. I don't know, Brittany, if you want to speak onto that too. I know I did, and it just helped my brain kind of wrap things up on that and just kind of stay focused.
Yeah, I mean, I think there's a lot of solid programs, and I would say, yes, I would say don't overwhelm yourself because basically the meat and potatoes of what the nurse practitioner board's exam has on it is going to be in most of those resources. So yes, I would, maybe you're doing questions out of one book and you're attending, the live review of another group, fine. But I would again not overwhelm myself, and I would definitely do, chunk by chunk. How do you eat an elephant? You take him one bite at a time, right? That's what I like to always say. And so, just, not overwhelming yourself because basically whatever speaks to you most, everybody's learning style is different, right? So you
Mm,
want to find something that works for you and with you. This is an investment, right? So you want to make sure that it's a good fit for you.
definitely. And definitely make sure you're kind of tuning into your personal learning style. Some are more auditory, some are more tactile, like writing notes out, some are just auditory. Really depends on what you are. Vince also said something about board vitals and FNP mastery. Honestly, I would just kind of take those questions as they are and then definitely make sure you go through and reread those questions. What you got wrong? Why did you get it wrong? Did you read it too fast? Did you skip over the answers? Kind of really hone in on why you're missing that question, if it's really a knowledge deficit or if it's just because you read the question too fast, which sometimes a lot of the times happen, especially when you're getting ready to test and you're taking those, you're kind of flying through them. But definitely sit down and take practice exams. I definitely recommend taking a full length practice exam just to trial it out. I mean, the questions are lengthy sometimes, it's 175 questions and you're sitting there for a while. It's a couple hours. So definitely make sure you're training yourself for the marathon. You're not just going to go out and run a marathon tomorrow, right? You definitely want to
Right.
practice. So practice makes perfect there.
And read the rationales. Like, even if you got it right, you might read the rationale as to, like that one I told y'all, it had HIPAA in it, right? And we reviewed what HIPAA was right there. So you kind of got bang for your buck on that, right? So read the rationales, even if you get it correct, and kind of know why you got it right. And kind of, I always say, know it forward, backwards, and inside out. So, know why and the understanding behind the meaning of why it's right. And that will also help you as you're answering these questions.
And then, especially with the holidays coming up, definitely have a study plan for the holidays. Don't take,
Mhm.
several days off. Don't kind of cram through. I would just say little by little, right? So do a couple hours here, a couple hours there. Do practice questions one day. Do reviewing your book one day. Something that's going to really tailor to it. Also, like pick a date to test and stick with it, right? So plan your schedule around that. Yes, you can have fun during the holidays. Yes, you can rest, but make sure you're also just keeping that knowledge going and keeping it fresh. The easier it's going to be on you.
Absolutely.
Definitely easy to get distracted with the holidays, but remind your family too. I made a reel about this on our social media. So if you're not following us, be sure to follow us on Facebook and TikTok and all those things. Um, you definitely want to tell your family and friends what your goal is when you're testing, if you feel comfortable. I knew I was one that I didn't really want to tell my family when I was testing. But again, that gives you that extra support, right? So make sure you tell them, hey, I need about 2 hours today to be able to study and be successful on my board exam this next week or the next few weeks. And just kind of give them that expectation, give them the boundary, give yourself grace too, take some time to rest during the holidays. That's what they're for. So, and spend time with your family as well. How do you stay focused with personal things that are going on and not let them be distracted? So, again, I would just really have a good balance of studying and get into like a routine, So, every morning, if you want to wake up and do your studying in the morning from like 8 to 10, if you're a morning person, or study in the afternoon, I think that helps. And then I'm a person that loves no distraction. So I personally thrive on studying in a library setting, in a coffee shop, something outside of my home. I'm not distracted by the doorbell ringing, my dogs wanting to go outside or barking at other things, my children at home, or my husband. Definitely removing myself from that situation helps a little bit. I am such a library study person. I love it.
Me too, Sam. I got to have like complete silence. And
Yeah.
my study partner in nurse practitioner school loved to go somewhere where it was loud and they were playing music. And I'm always like, I can't study with you. because it's just
Yeah. And that's important too, figuring out your study technique, right? Like if you study well with groups, if you study well individually, or finding that location, like Brittany said, like I can't study with really loud, obnoxious things going on. Like that's something to implement in your study plan as well. That's a great point.
yeah. And kids and pets and husbands are definitely easy distractions for sure.
Oh, yeah, for sure. All right. Any last participants going into this survey here? I have two responses. So go ahead and put more in there if you haven't done that already, and then we will go ahead and announce the winner here soon. Any other questions about board prep, what to expect, anything? We are here for you to answer your questions. We also have a lot of webinars this week, so make sure you tune into that. We have one almost every day this week. We have musculoskeletal tomorrow. I think there's a neuro one coming up, Brittany. I think yours is on the 16th.
Yes.
We have diabetes pharmacology, and then we have EKG review this week with Rachel too. So make sure you guys are signed up to attend that, and we'll be giving away some more giveaways as well. And be sure also,
Good. You guys will see me all week. I signed up. Good. I'm glad. Yeah, join us.
yes, please do. The more the merrier. We love helping you and seeing you do well.
Yeah.
All right, I'll give it about 30 more seconds, and then we'll go ahead and announce the winner. Any last takers here? All right, so I will go ahead and let you know that Patricia is our winner today. So congratulations, Patricia. I'm going to go ahead and email you with your SurePass Pro package. So make sure that you are looking for an email from me and we'll get you started and get on your way to studying and becoming an NP here real soon. So we're really excited.
Absolutely. Well, anything else? We're here for another minute or two, and then we're going to let you all go and enjoy the rest of your Monday. Catch some of our other webinars, like Sam just mentioned. You guys can sign up. And if nothing else, again, just connect with us on social media. We would love to have you to follow us. And congratulations, Patricia, again to you. All right. Anything else today? I think we've pretty much wrapped it up. Yep, more giveaways on the horizon. So if you didn't win today, that's okay. You can catch us again, and there'll be more giveaways coming up.
Yes, for sure. Make sure that you join us on all socials. Stay tuned for more giveaways happening this month for the holidays. And then be sure if you're interested in joining our 3-day live review, that's coming up very quickly in January. So January 3rd to the 5th, we hope to see you guys there.
Yeah, yeah. And if you got the SurePass, that's included. And you can email us too if that's, if you're not seen on the website or whatever, and you just want to sign up for that only, you can do that. Just send us an email. All right. Well, I think I'm going to go ahead and end it here. I hope y'all have a great rest of your week, and I'll see you next Monday, same time, same place, and catch us on the